Thank you, Mr. President. Excellencies, distinguished delegates, ladies and gentlemen. I speak on behalf of the Global Alliance on Health and Pollution, or GAP. GAP is a collaborative community that includes a number of developing countries, bilateral and multilateral donors, and relevant United Nations agencies, including UN Environment. GAP's objective is to address pollution and health at scale. Our mission is to work for a world where the health of present and future generations, especially children and pregnant women, is safe from toxic pollution. In October this year, we published the Lancet Commission report on pollution and health, and we are delighted that UN Environment, an active GAP member, picked a pollution-free planet as the theme for UNEA 3. Mr. President, we believe that the resources currently allocated to prevent and remediate pollution do not do justice to what is the single biggest killer in the world today. Instead, we need to urgently mainstream and prioritize action on pollution within national and international development plans. It is critical that governments elevate the profile of pollution control in development budgets and that their development partners respond appropriately. Unless we work together, we will not be able to achieve Sustainable Development Goal 3.9, which requires that by 2030, the number of deaths and illnesses from all forms of pollution be substantially reduced. Mr. President, programs and projects to address pollution should focus, at least in part, on reducing the burden of disease from pollution by measuring public exposures and prioritizing pollution challenges and solutions based on health impacts. Planning to address pollution effectively must also involve all the relevant government agencies and not be considered just the responsibility of ministries of environment. The Lancet Commission highlighted the extreme toll that pollution takes on health and economic productivity, but data gaps remain. Decision makers need more complete data on the impacts of pollution at the local level, particularly of exposures to chemicals of known toxicity such as lead and emerging pollutants such as endocrine disruptors. These are largely undercounted at present in studies on the global burden of disease. Until this data gap is filled, we will continue to underestimate the true costs of pollution. We hope UNEA 3 will prove the inflection point when global action on pollution begins in earnest. We thank UN Environment for its continued support and the Government of Kenya for its warm hospitality. Thank you, Mr. President.